they get bonuses, or the hospitals get bonuses if how much medicine that they can sell. So instead of telling you what you can do to prevent, which is what the things that you put in your mouth and in your body, they just give you more and more medicines because they want to keep you sick. They don't want to heal you. They want to keep you sick, which is very interesting. So I want to go to our first video, and I want to dig a little bit deeper into this topic.
Or control a health insurance division? Raise your hand. Please keep your hand up if you also employ healthcare providers or own clinics, specialty pharmacies, or any other kind of medical practice or pharmacy. Please keep your hand up if you also own or control a pharmacy benefit manager. And please keep your hand up if you lead a publicly traded company at which you have a legal responsibility to maximize shareholder value. So we've established on the record that the largest health insurance companies are not just insurers. They are also medical providers and pharmacies, diagnosing and deciding treatment for patients. They are also PBMs, another form of middlemen managing drug benefits. They are increasingly controlling every aspect of our healthcare system.
That clip matters because what you just watched is the quiet part being admitted out loud. The biggest health insurance companies in America are not just insurance companies. They employ doctors. They own clinics. They own pharmacies. They control pharmacy benefit managers, the middlemen who decide which drugs you're allowed to get and how much you will pay for them. So let's stop being polite and using proper language to call this something that it's not. This is not insurance. This is a well-coordinated scam hiding in plain sight because the same corporations that decide whether your care is approved are also diagnosing you, deciding your treatment, dispensing your medication, and profiting at every step along the way. That is not oversight. That is total control of care, pricing, outcomes. And here's the part that makes this so dangerous. These companies are publicly traded, which means that their executives have a legal obligation to maximize shareholder profits. Your health is not the priority. Your doctor's judgment is not how things are decided. It is all about profits.
Incog 46454 hit it on the head. They said curing you will kill the pharmaceutical business. They need to sustain your illness to sustain profits. Whoo! So what do you think, Aisha? What's your thoughts about that video that you just watched?
Yeah, I saw that video last week and I was in awe. And I think the biggest part is they circulate the money amongst themselves over and over again because they understand how the system works. So they're in one industry, but because they know that if they can now tap another industry, they can still make money, profit from that industry. So they find a way to make a web and then just keep getting the money back over and over again, literally circulating the profit within themselves and finding a way to even make more profit without thinking about the people that they're affecting. I was in awe, and just listening again does make me like, wow, this is insane. But it's true. That's what happens. They know each other. They call each other up. What do you think? Well, let's create a network of doctors to do this A, B, C, D, and let's connect with the pharmaceutical chain and do A, B, C, D, E. We give them the drugs. They prescribe the drugs. They work together.
Renee, how long would you say that this has been happening? In your professional opinion, is this something that's new or it's been happening for a long time?
This has been happening since the 1800s. It's an ongoing, this is a systemic situation. I was just getting ready to say that for, you have 3 phases, well, actually 4 phases in clinical trials, and up to phase 1, 2, and 3. 3 is where you can actually mass produce once you get approved by the FDA for the drugs. So it takes it costs about maybe $100 to $300 million to get the drug approved in phase 3.